This presentation will address electrical stimulation principles. There's two main uses of e-stim. One is to control pain, and the other is to contract a muscle. And when we are working to control pain, we have two sets of parameters. We call one of them sensory level, or high rate tens, and the second one is motor level, or low rate tens parameters. Under contracting a muscle, we have neuromuscular reeducation. That means that that would be a reason why we would want to contract a muscle, is to re-educate a muscle to contract. So after a surgery, perhaps a post-op ACL, and the athlete comes in and they can't contract their quadriceps, so we could use electric stim to help them achieve that by using those parameters. And then also if we have somebody that they can't decrease a muscle spasm, this might be another tool that we could utilize to try to do that. Under pain control, let's address the two different parameters that we can utilize. The first one is sensory level pain control, and when we set this up, we want the pulse duration or pulse width, same thing, to be between 60 and 100 microseconds. The pulse frequency or rate should be between 80 and 200 pulses per second, and our intensity will be sensory level intensity, which means we increase it until we see a muscle contraction, and then we decrease it by about 10%. So the sensation should be a strong, buzzy, tingly feeling. This is a great set of parameters for introduction to electric stim if the patient hasn't ever experienced it before. And it's kind of the first level of trying to decrease pain with electric stim. You need to memorize these parameters and make sure that you remember which units goes with which numbers. Then under motor level pain control, we might use these settings if we didn't get good results from sensory level, or somebody has chronic pain and they respond maybe better to motor level pain control, or it lasts a little bit longer. Our parameters are 150 to 250 microseconds for our pulse width or duration, so a little longer current duration. The frequency, however, drops to 1 to 5 pulses per second, so you'll actually be able to see the muscle twitch with these parameters. The intensity is motor level, and that means we increase it to a strong muscle contraction. So two very different sets of parameters, and I would recommend typically starting with sensory level pain control with an athlete or patient and seeing how they tolerate that or how that works to decrease their pain. With muscle contraction, we aren't contracting the muscle fiber directly. Actually, we're causing a depolarization of the alpha motor neuron that attaches to that muscle. So as long as we have a good connection from the nerve to the muscle, these parameters will work in getting the muscle to contract. We want a really long pulse duration, so we're going to set it to 300 to 500 microseconds. And actually that's pretty long, and sometimes the machine, when you push NMES, it'll automatically set that up as a safety check so that you can't go beyond 500. Pulse frequency will be between 35 and 70 pulses per second. So if you can imagine watching a muscle twitch 35 pulses per second, it doesn't even have time to repolarize, and so we get this summation of contraction, and we get a good technique contraction at 35 pulses per second, and you can take that up to 70. The duty cycle will vary based on what we need. So the duty cycle is the on and off time. So if I'm doing muscle reeducation, I might have the duty cycle be 10 to 10, and 10 seconds so the current's on and 10 seconds off. So we're just teaching the muscle just to turn on and hold for a while and then turn off. It's submaximal. You might use it to decrease muscle spasm. So maybe you want the muscle contraction to be quick, so 1 to 1, 1 second on, 1 second off until the muscle fatigues. In your book, it talks about Russian stimulation, and there's even buttons on most machines that are called Russian stimulation. It's just a higher level or a little more intense for strength training, and the duty cycle is typically set at 10 to 50, so 10 seconds on and 50 seconds off. And they're doing a maximal contraction. This actually did take place, started in Russia with Olympic weightlifting athletes to see if they could recruit more muscle fibers so that they could lift more. The studies have never been reproduced, and so it's actually gone into the therapy world of orthopedics with Russian stim and isn't used so much in strength training. Interferential current, there's quite a bit in the book about this. However, I want to make mention of just a few things. Remember that it's two medium frequency currents that crisscross. And because they crisscross and they have different frequencies and different amplitudes, we get this interference, they call it. And so we have a lower and then a higher intensity of current, and then a low and then a high to decrease accommodation. This type of current or waveform is used primarily for sensory level pain control. So we'll set the parameters up with sensory level pain control. IFC tends to work a little bit longer, like after you take the electrodes off. The pain control is a little longer and felt a little deeper because of the medium frequency currents than if you would use a TENS unit, like a personal TENS unit, or a biphasic waveform set up on your machine for sensory level pain control. And we'll practice that in lab so you can experience the difference. So hope that helps clarify some things, and remember that you need to memorize those parameters for pain control. There's 2 sets of parameters, and muscle contraction. There's really only 1 set of parameters, and we can adjust the duty cycle.